I'm a junior at the W. I'm working on my RN BSN degree and doing a little presentation on antibiotic resistance. I'm gonna hand these little flyers out. Right there. All right. Antibiotic resistance is a growing problem around the world. Too many people are getting bacterial resistant that's resistant to antibiotics, and 23,000 people are dying annually. This right here is the antibiotic resistance cycle. Due to increased antibiotic use, have increase in resistant strains, and then you got ineffective empiric therapy. Basically, if you go to the physician or practitioner, most of the time they're going to give you an antibiotic. Most of the time, when you go to the doctor, it's usually caused by viruses, and they're going to treat you with an antibiotic. Most people want a prescription, or they want an antibiotic shot, because they go to the doctor, go to the ER, and you tell them it's a virus, they're not happy, so they'll go somewhere else just to get the antibiotic, just to make them feel good, they think. So when you take an antibiotic, basically you're increasing your chance of resistance. Anyway, then it causes increased hospitalization due to more antibiotics, causes increased healthcare costs. Patients are spending more time in the hospital, and what do they usually do? They're going to give them antibiotics. This year we've initiated a sepsis protocol, and I think it's kind of blown out of proportion, because if patients come through triage and they got fever, say at least 100.4, heart rate's up, and they meet certain criteria, we put in this sepsis protocol, and we get all this lab work, blood culture, blah, 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 and then we have to hit them with some IV antibiotics. And then in turn, we went on lab work, and then sometimes it comes back, it's the flu. So what have we done? We gave them an antibiotic that they didn't really need. So anyway, I'm gonna go to my PowerPoint presentation. It's antibiotic resistance. Sorry. I hit the wrong key. There we go, sorry. All right. Antibiotics have transformed our ability to treat infections, but they do not work as well as they once did against some infections. So people are basically going to the doctor, and they're doing throat cultures, and they're coming back negative, and they're assuming they got strep infection. So what do? They give them an antibiotic. So you're basically building a resistance every time you take one. So it's basically you need to quit pressuring your provider or physician or whatever to give you an antibiotic when they tell you it's a virus. Most people leave one antibiotic. Then you got how antibiotic resistance happens. Antibiotics have transformed ability to treat infections, but they do not work as well as they once did against some infections. As you can see right there, I don't know if y'all can read that or not. Anyway, we'll go to the next one here. See, it's got lots of germs, a few are drug resistance. Antibiotics kill bacteria, causing the illness, as well as good bacteria protecting the body from infection. The drug resistant bacteria are now allowed to grow and take over, and then some bacteria give their drug resistance to other bacteria, causing more problems. All right, about resistance. One of the common things we see in the ER is C. diff, or Clostridium difficile. They come in here because they've been on so many antibiotics that they have killed the normal flora in the intestines, and they got lots of diarrhea, and it's contagious. And what this in turn, it causes the patient to be put in the hospital, and usually they have to treat the C. diff with more antibiotics. Antibiotic antimicrobial resistance is the ability of microbes to resist the effects of drugs. That is, the germs are not killed and the growth is not stopped. Although some people are at greater risk than others, no one can completely avoid the risk of antibiotic resistant infections. bacteria will inevitably find ways of resisting the antibiotics developed by humans, which is why aggressive action is needed now to keep the new resistance from developing and to prevent the resistance that already exists from spreading. All right, what are microbes? Microbes are organisms too small for the eye to see and found everywhere on the earth. There are many types of microbes, bacteria, virus, fungi, and parasites. But most microbes are harmless and even beneficial to living organisms. Some can cause disease among humans, other animals, and plants. These disease-causing microbes are called pathogens. Sometimes they are referred to as germs or bugs. Microbes are organisms too small for the eye to see and are found everywhere on the earth. There are many types of microbes. Did I just read that?
Mm-hmm. You done the last one.
All right. Sorry. Disease-causing microbes. All right. Strep throat, bacteria, we usually treat that with antibiotics. A lot of times they come into the ER and we do the throat cultures and they come back negative, and what do? We give them antibiotics because we're assuming that's what they got. They got strep. And then you got food poison. This bacteria, salmonella, we treat that with antibiotics. Common cold viruses, we try not to, but we do. And even the flu, they come in test positive for flu. Used to, we give them the Tamiflu, and then some physicians, whatever, say, which flu lowers your immune system, and what do? They're going to give you an antibiotic too to go along with the Tamiflu. Athlete's foot, fungi, and malaria parasite. All right. What everyone should know. All right. Antibiotic resistance is a growing problem across the world, and the main causes of this problem is overuse and misuse of antibiotics, which we've already stated. All right. If you have a cold or flu, antibiotics will not work for you. You go to the doctor, you got a sinus infection, they're going to give you usually an antibiotic shot, most time with a steroid. And colds, flu, most sore throats, bronchitis, and many sinuses and ear infections are caused by viruses. Antibiotics do not help fight against viruses. They consider fever now at least 100.4 or over. And just like I said, the sepsis protocol, if they got fever over 100.4 and the heart rate's up, we had to put a comment on the tracker board, sepsis alert, and then they ordered this gigantic workup with IV fluids, 30 cc's per kilo, blood cultures, lactate, and then we usually have to hit them with an antibiotic within 3 hours. And it's a big workup for patients for us. All right. Antibiotics cure bacterial infections, not viral infections such as cold or flu. We see a lot of that in the ER. Most cause some bronchitis, most sore throats, runny noses. All right. Taking antibiotics for viral infections will not. All right. Cure the infection. Keep other individuals from catching the illness. Help you feel better. All right. Antibiotics can cause more harm than good. All right. Taking antibiotics increases your risk of getting an antibiotic-resistant infection later. Antibiotics kill the healthy bacteria in the gut, allowing more harmful bacteria such as C. diff to grow in its place. There's 18 different kinds of antibiotic-resistant bacteria, and C. diff is the the number one, that's most of the one we see in the ER, and these folks are pretty sick, and they're usually put in isolation. Antibiotics cause 1 out of 5 emergency room visits for adverse drug effect events in children under age of 18. Preventing the spread of resistance. Avoiding infection in the first place reduces the amount of antibiotics that have to be used and reduces the likelihood that resistance will develop during therapy. All right, ways to prevent drug-resistant infections. Immunization. All right. We do see some children that do not have their immunizations. In some cases, we see some measles, and then we have to report that. Safe food preparations, like salmonella, we do see that. Good hand washing. If everybody did this, a lot of us wouldn't be sick. We usually have a hand sanitizer on the walls in the ER that we use religiously. Using antibiotics is directed and only when necessary. All right, what to do? All right, ask your healthcare professional about what you can do to stop or slow down antibiotic resistance. But most of the time, the pharmaceutical companies are pushing the physician practitioner to write it. Okay, they get permission. That's the reason they bring it. Ask if there are steps you can take to feel better and get relief from your symptoms without using antibiotics. All right. Take the prescribed antibiotics exactly as your healthcare professional tells you. And another way to get antibiotic resistance is people will take an antibiotic for a few days and then just quit and won't finish the antibiotic. I get so mad at it. Safely discard any leftover medication. All right. Ask your healthcare professional about vaccines recommended for you and your family, which is a requirement for us to get before that. Never taken an antibiotic for a viral infection like cold or flu. And I know some of us get worried if the fever lasts, for 4 or 5 days.